Hey everybody, and welcome to a quick lesson on how to get more patients with niche marketing. My name is John Cummings, and many of you know me as the founder of BodySite, the digital health guidance platform that helps doctors run more profitable practices by getting better results with less time at work. Today we're going to talk about niche marketing because it doesn't matter how efficient you are in running your practice if you don't have enough patients to bring in more revenue into your business in the first place. If you already have too many patients, this lesson might not be for you. Now, many of you already know that I'm not a doctor. I'm a retired attorney who happens to have a passion for patient education, internet marketing, and business automation. And the reason I'm perfectly suited to give you this lesson is that I leveraged niche marketing to become successful in my law practice, and I've been giving the same advice and concepts to doctors and lawyers for over 20 years. What do doctors and lawyers have in common? Well, they're both horrible at getting new clients, and it's not your fault. Graduate school simply doesn't teach you how to get business. When you hang your shingle as a doctor or a lawyer, clients are supposed to just magically appear at your office. Well, that was the case a long time ago, but right now there are just too many doctors in any given community competing for the same business. One way to get around that saturation problem is to be a specialist. If you're a foot doctor, people know they should call you if they break their foot. But what if you're a general practitioner or a functional medicine doctor who offers a whole spectrum of services? How do you get patients to know that they should call you when they don't feel their best? How do you stand out from thousands of other doctors, chiropractors, nurses, health coaches, nutritionists, and other provider types that offer the same general services? You guessed it. Use niche marketing to make yourself a specialist. And here's why. Most of what you do every day as a practitioner is not obviously helpful to your target audience. So if you put out an ad that says we offer annual physicals, hormone replacement, nutritional counseling, wellness coaching, you're not going to get anybody's attention, even if you say you take all types of insurance and list all of your credentials. That type of advertising doesn't separate you from anybody else in the marketplace. People on the internet and social media don't want a list of your services and details about your office. They want a solution to their problem. So to attract patients that match the services that you offer, market to your ideal patient a solution that fits one niche that you're good at and that you know will get patients to come see you. The pharmaceutical industry has this down pat. Each pill on the market addresses one problem. So when you turn the TV on, you'll see commercial after commercial about a drug that solves one problem. And it usually starts with a question like, do you suffer from moderate to severe something? Now when that commercial comes on, anyone not suffering from, say, plaque psoriasis is going to tune out. But people that do have that problem are fully engaged and say, wait, you can fix this? That's niche-based marketing. The ad is focused on the niche of plaque psoriasis, unlike an ad that offers health coaching or hormone replacement. What if someone doesn't know that they need hormone replacement in the first place? You fail to engage that potential client. So instead of marketing about diabetic neuropathy, ask your audience if they have pain in their feet. Instead of marketing about hormone replacement, ask your audience if they have lower libido, hot flashes, or so on. Here are some other examples. Are you overweight? Do you have pain in your feet, back, or knees? Are you tired? Are you suffering from low sex drive? Are you having trouble losing belly fat or sleeping at night? Now, if you're a provider watching this lesson, chances are you have services for many of your potential clients' needs, and you're wondering, which of these services should I advertise? Which niche do I focus on? Just don't advertise all of them. That's the big mistake that providers are making right now. Pick one niche for one ad and try it out. Now, the obvious choice is the service that you do best or that generates the most revenue or profit for your practice, but you can also pick one that's a loss leader that gets people to call you. Weight loss is a super obvious niche because most of the people watching or reading your marketing who say, yes, I do have those problems, are often overweight. That alone can contribute to sex drive, foot pain, and obviously belly fat. So if you have a weight loss program in your office, try that. Try a print ad or radio ad or social media that asks some obvious questions and then offer the solution. Make sure you've got a program to solve that and a procedure in place in your office to implement the solution effortlessly and at a price that gets people to buy that service from you. And if you want some examples of ads that work and some that don't, or if you need a program that helps you implement a solution for weight loss, for example, when patients start calling you, enter your email and we'll give you additional practical advice on getting more patients and delivering a solution to the problem they came to you for, because of your new niche-based targeted marketing approach. That's all for this lesson. Stay tuned for more like this and be sure to visit bodysite.com for turnkey programs to implement in your practice as your niche-based marketing takes hold and brings you more patients.